Hi everybody, my name's Professor Rachel Allavena and I've founded a company called Animal Immuno Solutions with my partner Dr. Annika Oxer, and it's our passion to help animals, particularly dogs, naturally fight their cancer using the cutting-edge science of immunotherapy. So let's have a look at how this science works and how it can help benefit pet dogs with cancer. But first, let's meet Griffin. Griffin, as you can see, is a Rottweiler. Sadly, Griffin was diagnosed with a rare and very aggressive cancer called non-epitheliotropic T-cell lymphoma, which was invading the skin of his chest. His loving owners immediately rushed him to surgery, but sadly by the time he returned to have his sutures removed from that surgery, the cancer had already come back. Griffin was offered chemotherapy, though it doesn't have a great success rate with this tumour, and the couple were really worried that the dog's waste products, like his urine or his saliva, would excrete toxic chemicals that would be potentially harmful to their infant daughter. So sadly they declined. They looked around for other alternative therapies for Griffin to help him fight his cancer. And we're going to learn today about one of those things and how it helped Griffin in his battle with the disease. Cancer in dogs is really common. About 1/3 of dogs will get cancer in their lifetime. And that cancer has the same sort of variety, appearance, genetics and behaviour to the cancers that we also see in people. It could be easily cured by surgery or life-threatening, regardless of the therapy that you pursue. So if your dog's been diagnosed with cancer, it's really important to get a viewpoint on all the options that you have available so you can decide the right course of treatment for your family and your pet. Firstly, let's talk about what cancer actually is. We call it one disease. You know, people talk about my dog has cancer or my family member has cancer, but it's really not the same disease. It's a group of diseases that share the same cause or the same mechanism. Cancer is actually a genetic disease. Mutated genes in the DNA of cells allow those cells to proliferate and grow out of control. Because the cancer cells become more and more genetically unstable and they're not able to edit and look after their DNA properly, mutations in the DNA increase over time, and that tends to mean the cells get nastier and nastier and more unstable. When cells transform into a cancer, they can acquire these powerful and damaging traits. Firstly, to invade into the tissue that's next to them and destroy it, and also to spread around the body, a process called metastasis, destroying organs that are important like the liver and the lungs. Within an individual dog, the cancer will form, because of its genetic instability, different colours of cells, and we call these sort of colours or themes of cells clones. Some clones might be relatively benign, they might not damage the body so much, but because of that genetic instability, some of the other clones acquire superpowers. They can induce the formation of blood vessels, allowing the cancer to get bigger, and they can even suppress the immune system. These clones we call more malignant. So even within a single individual dog, we're going to have all these different clonotypes, and this phenomenon is called cancer heterogeneity. And because a particular clone might be able to resist a particular chemotherapy drug, then cancer gets really difficult to treat. Because if you kill off the cells that are susceptible to a therapy, there may be others there that can reform the cancer because they're resistant to it. And this phenomenon of cancer heterogeneity gets even more complex when we start to think about a population of animals with the same cancer. So say these dogs here in this graphic, they all have lymphoma, or we may have a group of women that all have breast cancer. Because of that tumor instability, the genetic mutations and the tumor heterogeneity, not all patients are going to be the same. So a therapy that works really well in one dog or one person may not work in others, and that's what makes cancer, really difficult to treat. And when we go at a whole population and we give them all the same therapy, some dogs will do really well and other dogs might not get a lot of benefit at all. So that really affects this phenomenon of mutation, and how cancer biology varies really affects how veterinarians and doctors approach how they treat. So let's unpack that problem a little bit more. So you can see here from this graphic, we've got a bunch of cells, and we're going to apply a drug treatment, and that's represented by the black line here, or the bottleneck. And that treatment works pretty well. It knocks off, 80% of the cancer cells, and the patient will look like they're going into remission. So that's a good thing. The tumors will shrink away. The doctors will find less cancer when they go in and look at that patient. And it certainly is a good response, and it will buy them some time. But the problem is the remaining cells that were resistant to that treatment eventually will regrow, and they'll reform the cancer, and the mass will come back, the cancer will come back, and the patient will come out of remission. And this phenomenon we call treatment failure. So it's the patients coming out of remission as those remnant cells that were resistant to the initial therapies regrow, and then they start to reform the tumor. And the thing is, the cells that survived in the first place to come back, they were already probably the nastiest ones. They were there. They were like very resistant to the therapy. They were probably very genetically unstable. So those cells already have a propensity to be aggressive and to mutate, and they're the ones that regrow the cancer. So if we apply the same treatments again, they're just not going to work, because that cell population was resistant to the therapy that we were already trying. And so when we're having therapy with an oncologist, they will often change the drugs or change the protocols or look at different approaches the more times a cancer comes back. They will also use lots of different therapies in combination just to overcome this malignant progression. So the cancers are going to get more and more genetically unstable and more aggressive as they mutate, as they are selected for by treatments, and as they become resistant to more and more therapy. So it's a big problem. So the phenomenon of cancer heterogeneity and malignant progression really governs how we tackle cancer, whether it be in veterinary or human medicine. We actually use multiple therapies targeting different weaknesses and different sort of malignancies of cells all at the same time to try and kill absolutely every cancer cell that's there in the body. And typically for about 100 years, we have used the slash, burn and poison approach, slash for surgery, burn for radiation, and poison for chemotherapy. That's been used both for pets and for people, though unless you're in a specialist area, so you're in a large capital city where you've got access to specialist veterinary oncologists, your ability to get to radiation and chemotherapy for your pet may be a little bit limited because it requires specialist equipment and expertise. But most veterinary surgeons will be able to undertake some sort of surgical therapy for your pet. However, emerging about 10 to 15 years ago in human medicine, we saw the fourth pillar of cancer therapy arise, and that's immunotherapy. So immunotherapy has only just started to be applied in veterinary medicine, and there's a lot of exciting emerging technologies for that. And it's very complementary and can be used at the same time as the other three treatments. So what is immunotherapy? Well, the immuno part comes from the immune system, and it's really an approach where the immune system is triggered to fight the cancer, to recognize that the cancer is a bad thing, that the body is under attack, and to mount an immune response to those cancer cells, just like they're an invading bacteria or virus. So this concept arose maybe more than 100 years ago by this Dr. William Coley, who realized that he could use bacteria and bacterial products to cure cancer in human patients. And sadly, his work was forgotten for decades before being revived in the early 2000s to 2010s, when scientists again became really interested in the phenomenon of using products that were derived from something called Coley's toxins, which are the bacterial products that William Coley helped develop. And that's been the basis of the research throughout my scientific career. And this company, Animal Immuno Solutions, that I've helped found, uses natural bacterial products and plant products to help kickstart the immune system so that it recognizes that the cancer cells are foreign and starts to fight them. So largely our approach, we're trying to use these bacterial and plant products to turn the animal's cancer into its own vaccine. So how do we go about turning a cancer into its own vaccine? What does the immune system need to recognize and fight the cancer, and why wasn't it doing it anyway? Well, actually, our bodies have immune cells throughout them, and those immune cells are actually really good most of the time at finding precancerous cells and killing them off before they actually form a clinically relevant cancer that doctors can detect. So that's happening most of the time, but eventually in some patients that surveillance system fails, and it fails for a couple of reasons. It might not see the cancer cells as foreign because they do come from our own tissues and they may resemble our own tissues. And the other thing the immune system really needs to sort of activate itself is a danger signal. It needs to know that there's a threat, and it uses special receptors on those cells to recognize various forms of threat. So bacteria, viruses, all those sorts of nasty things that invade our body, they express these threat chemicals on their surface, and it's really obvious when they show up and they're not welcome in the body that a threat is present. The immune cells sense the threat molecules on the surface of bacteria and viruses, and then they go into overdrive, and then they'll mount an immune response based on the foreign proteins that are presented by the bacteria and viruses. But with cancer, because it's either not threatening enough, it's not creating enough of a danger signal, or the foreign antigens maybe not as overt as a bacterial or viral thing, it can kind of fly under the radar and evade the immune system. The other thing with cancers, they're pretty sneaky, and one of the ways they adapt to threaten the body is they immunosuppress. They release all these molecules that actually dampen down the immune response and shut off the immune cells. And so with our approach to immunotherapy, we're using the danger signals that are naturally present in bacteria and in some plant products to wake the immune system up and make sure it realizes that there is danger there. Then usually because of the genetic instability in the cancers, there's usually enough foreign proteins in that cancer because it's gotten all mutated and it started making sort of weird and sort of wonky proteins. Between the mutations that are already naturally present in that cancer and the danger signal that we induce, the body's immune system will wake up and then start to fight that cancer naturally. So let's unpack the immunology a little bit more, just because I can't help myself. My PhD was in immunology. So basically we've got our foreign antigen. So in that case, we're looking at a cancer antigen, but in a normal infectious disease, it would be some sort of foreign antigen that's on that bacteria or the virus. We've got the danger signal. Again, bacteria and viruses provide their own, but in our approach, Animal Immuno Solutions is inserting a danger signal into the context of the cancer that then wakes up the immune system. This danger signal activates a part of the immune system called innate immunity. And there's a bunch of cells there that are basically on surveillance. They process the foreign or mutated proteins that the cancer is producing or the bacteria have, and they present them to other parts of the immune system, in this case the acquired immune system. And the acquired immune system actually ramps everything up, switches everything on, and then deploys the weapons that it needs to attack the invading cancer cells or the invading bacteria. So the two arms of the immune system, the innate immune system, the acquired immune system, actually reinforce each other during an immune response and will develop the tools and the weapons necessary to then take on that threat and help protect the body. So using this approach, we can turn the dog's cancer into its own vaccine. Now, during our development of these products, we realized that veterinary patients came in two major categories. Firstly, there are dogs where surgery isn't an option. Perhaps, the tumor's on their paw or on their leg, and the owner doesn't want the dog to be amputated. That would be like a very serious approach, a very serious sort of surgical consequence for the animal. Or perhaps, like in the case of Griffin, the dog that we met at the beginning, they try surgery, but the cancer comes back. So there's residual tumor present. Now, the products that we have at Animal Immuno Solutions for those scenarios where there's actually still cancer in the animal's body are called intratumoral immunotherapy. And we have our danger signals packaged up as part of our products, and they can be injected safely into the animal's cancer directly, triggering the immune response directly in that cancer. So it's not a systemic therapy, it's very localized, so it's quite safe and it's well tolerated by the animals. And literally the danger signal in that animal's cancer then will trigger the immune response and hopefully produce some benefit to the patient, such as killing off the cancer or improving the immune signaling that's going on in the cancer. The other types of patients we see in veterinary medicine are those where the cancer can actually be successfully removed, but we're worried about it coming back. We're worried about it spreading in the body, or maybe it's spread in the body already because it's an aggressive cancer and it may have spread to the liver or the lungs. So the animal needs, further treatment to try and get that disease under control. So for those patients where we can actually take a piece of the surgical tumor out, rather, we might want to remove the whole tumor in its entirety, or maybe we can only just get a piece of it, but we can get that tumor out. We can make something called an autologous vaccine, where we harvest the tumor proteins in our laboratory, we mix them with the danger signal, and then that gets put back into the dog's body like a normal vaccination that a puppy would get, sort of, in the base of the neck or into their muscles to trigger an immune response like a normal vaccine. So we can look after both patients at Animal Immuno Solutions. We can accommodate those that have tumor still in their body, and we can accommodate those that have had the tumors removed. So let's look at the approach where there may still be cancer in the animal's body. So that's intratumoral immunotherapy. That means we put the therapy directly into the tumor that's still present. We have two products. The first one, Neostim, consists of a thick paste with bacterial danger signals in it. It's injected directly into the tumor. We can see the graphic here in a number of different places by your veterinary surgeon. And the thick nature of it means that it persists in the tumor for a very long period of time, creating a very, very powerful danger signal. And that's really good because it means we only have to do that injection once. If we actually did it twice, it would be too much immune stimulation. So it's really quite cost effective, and it's also very easy to do because the animal just has to come into their vet and have that single injection. For diseases where we're a little bit more worried about spread, or the tumors are naturally a lot more aggressive, such as melanoma, we can combine our Neostim with an additional second immune booster. An immune booster is called an adjuvant. This one is a combination of plant products and bacterial products, and this product's called Neostim Plus. The two different adjuvants are injected into the tumor again and provide long-term danger signal immune stimulation that tells the dog's body that the cancer is actually a foreign invader and that it should wake up and start to fight that tumor. Now, here's some data from a paper that I published looking at the role of Neostim in fighting cancer in dogs. And in this paper, the therapy was also tested in rodents as laboratory animal models, horses, and people. So it was quite a big comprehensive scientific work. And this image here is from that paper, and it shows on the top line a Rottweiler that had something called a high-grade mast cell tumor, so very malignant. The survival time for these cancers is only about 3 months, in his nose, so in his lip. And it couldn't be removed surgically because of where it was, and it would have had to result in the dog having his nose cut off, so that was not an option. He had a chemotherapy treatment called Palladia, and that worked for some time, and then sadly the cancer came back, because remember, cancers mutate and they tend to become resistant to treatment. So this dog had a single very low dose of Neostim, and we can see in the middle panel here the cancer before it was treated, and then about a few weeks after, the cancer disappeared. The cancer from his nose completely went away, and it never reoccurred. And the very last panel, that C panel, is the tissue after the cancer has disappeared. We've taken a small piece of his lip just to look at what's going on, and we can't see any of the cancer cells there. All we can see there present are immune cells. Okay, so the Neostim has come in and it's taken out that high-grade mast cell tumor that was already refractory to Palladium. Now, in the middle panel, we have a German short-haired pointer. Now, you can see he's got a cancerous mass on his thigh, and you can also see the really large scar that he has, because he had an initial surgery and then a really severe surgery to try and get rid of this cancer, and it still came back. So he'd failed his radical surgery. The middle panel E there is the cancer from that dog, and we graded this one as possibly a grade 2 or a mid-grade cancer. And this dog, he had another mast cell tumor behind his neck, and we didn't inject that one. We just injected the one in the thigh. And what was really interesting about this dog, again, he was probably only given 8 to 12 weeks to live, was that the cancer in the thigh that we injected went away. And again, in panel F, we can just see the immune cells left. There's no residual cancer. And that cancer stayed gone. And interestingly, the one that we didn't inject in his neck, that one also disappeared. So that's consistent with the immune system doing surveillance across the whole body, and making sure that it kills all the cancer cells that it can find. So this dog, he was only given about 8 to 12 weeks before the Neostim therapy, and he actually survived for 18 months. The top dog, again, he was only given about 8 to 12 weeks, but he survived for a year and sadly passed away from an unrelated bone cancer. Now, the little dog on the bottom, she had the tumor, a low-grade mast cell tumor on the back of her wrist, and that wasn't able to be successfully surgically removed because of where it was and the temperament of the dog, and it would have been really uncomfortable, and actually to cure that they would have recommended amputation, and it just wasn't an option. So she had Neostim therapy, and the cancer, as you can see, has disappeared again with just immune cells present and some scar tissue, and it remained gone. That last treatment image there is actually 7 months after we treated the mass on her leg. We retrieved the tissue and it remained gone. And sadly, at that 7-month period, that she died from an unrelated nasal cancer as well. So this data shows us that Neostim will induce the remission of cancers. And in this data, we focus particularly on mast cell tumors because they respond very well to immunotherapy, and it was a nice case series to present. Here's a little bit more data from that same paper. And in this data, we are looking particularly at 2 different types of leukocyte that represent the acquired immune system. So these are the cells that orchestrate, direct immune responses, and also are part of the killing weaponry when they're fighting either infectious diseases or cancer. And we've got, these are tissues from that Rottweiler that we had in the top of the last slide. And we're looking at the T cells and the B cells, which are types of lymphocytes in his cancer. So the A and B panels are the T cells at the top and the B cells at the bottom in that nasal cancer before he had any treatment. The middle panel is that same area after the cancer's disappeared, again looking at those 2 types of immune cells, T and B cells, just showing that there's a huge amount more of them now that have been induced to come to that site by the neostim therapy. And the last panel here was that dog's tumour in his nose stayed gone forever, but he was very, very prone to getting mast cell tumours, unfortunately. And after about 4 months, he developed another one on his neck, but that one was able to be successfully removed, unlike the one on his nose. So we recovered that tumour. We didn't retreat him because our scientific protocol didn't allow for that, but we recovered that one from his neck and had a look. And you can see that compared to the pre-treatment tumour on his nose in A and B, there's a lot more immune cells naturally in the ENF panel in the new cancer that arose on his neck. That cancer wasn't completely removed at surgery, but it didn't reoccur after the surgery, even though it had dirty margins. So that suggests, when we look at this data, that the neostim's able to induce sort of a more prolonged systemic immune response to other types of cancer that might arise of the same variety as the one that was treated. Now, this is data from a little dog that was treated with Neostim Plus. So this little dog had a very aggressive melanoma in her mouth, and melanomas in the mouth and the nail bed and the lips are really, really aggressive in dogs. And this one was behaving aggressively. You can see it's a very large mass, and it also had metastasized or spread to the draining lymph node on her neck. The top panel is 3 weeks after she had received an injection of Neostim Plus. So we can still see that the cancer's there, hasn't completely shrunk away, and the histopathology just shows the tumor cells with all the brown pigment in them because it's a melanoma. But this dog had a really great response. By 6 weeks, that mouth tumor's completely disappeared, and we can see on the histopathology all the cancer cells have disappeared, and what's left is just normal mouth tissue. So we recommend Neostim Plus because it's got the additional boosting adjuvant in it for really malignant tumors, and those where there might already be spread proven in the body, just to give the animal a little bit of extra immune stimulation. So that was data from our intratumoral approach. So that's for cancers that are still present in the body. This is just to show you the workflow that your vet will need to do if your dog's tumor can be surgically removed and you'd like to get our other option for therapy, which are the autologous vaccines. Now, Canvax is a very gentle vaccine. It has very few side effects. It's been tested in a very wide variety of cancers, and we recommend it for pretty much any cancer that can be surgically removed. Neovax is a different formulation. It has a much more potent and powerful immune stimulant in it, and we have only tested that in dogs with osteosarcoma or bone cancer, which is a very, very aggressive malignant cancer. And because of its potency in the adjuvants, we really only recommend that for bone cancer treatment in dogs. So what happens with these autologous vaccines is your dog goes to the vet, all or some of the tumor is removed, and the vet will need to freeze it straight away before shipping it to us at Animal Immuno Solutions, where we make an individual vaccine just specifically for your pet. We return the vaccine to your veterinarian and they will administer it based on the treatment protocols recommended for Canvax or Neovax, because they're quite different. So Canvax is delivered as 4 injections over a week. That's called a priming phase, and it really helps boost the immune system up really high. And then the dog has maintenance or booster doses every month. So when we dispense Canvax, you get like a full treatment course of 6 months for your pet. Neovax, because it's got a very, very potent adjuvant, it's delivered as 1 priming shot and then a single booster shot 3 weeks later, and that's the full treatment course for that animal. You can use Canvax in osteosarcoma patients. My own dog, he had osteosarcoma, he was a greyhound, and he had Canvax for his osteosarcoma because we hadn't progressed to trialing Neovax at that stage, and he did very well. He couldn't tolerate his chemotherapy. We wanted him to have chemotherapy, but he got really, really sick, and he wouldn't eat, he couldn't move. So we stopped his chemotherapy, and he just had Canvax, and he survived for a year and a half before, unfortunately, we had to put him down because of just old age. He just started having trouble getting around, and yeah, he was a greyhound and he was 12 years old, so it was sort of time to say goodbye. So this is the general approach for the autologous vaccines. Your vet has to do the surgery, freeze the tumor, and then send it to us to make the vaccine, and we send it back to them to administer for you. Now, Animal Immuno Solutions, we only use high quality frozen tissue. The tumor has protein epitopes, which are like locks and keys on its surface, and the immune system has to recognize those specific ones in the cancer in order to fight it. And if you use formalin fixed tissue, which is the normal way vets use, or preserved tissue for biopsies in histopathology, the formalin actually cross-links all the proteins and binds them up and stops them being presented to the immune system properly. So unfortunately, we can't use formalin fixed tissue. So if you need histopathology done and you want the vaccine done, your vet will need to get one sample of frozen tissue and one sample of formalin fixed tissue. And we also cannot use the paraffin blocks that are used to make the histology slides for diagnosis for pathologists, because again, the paraffin blocks have been formalin fixed, and paraffin embedding for tissue also has a lot of toxins, particularly a very nasty chemical called xylene, and it wouldn't be appropriate to use paraffin embedded formalin fixed tissue because the proteins that we are looking to trigger an immune response against are largely destroyed, and also there's residual toxic material in those samples. So it's really important that if you would like immunotherapy done for your pet and you would like an autologous vaccine, that you talk to your vet about getting that frozen tissue so we can manufacture a high quality vaccine for you. So let's look at some data from the animals that have received autologous vaccines. So these two dogs that I'm going to show you have received the Canvax treatment. So here's Griffin. We met Griffin right at the beginning of the talk. Here's his cancer, the pre-treatment non-epitheliotropic T-cell lymphoma, so very aggressive cancer. He's had his surgery, the surgery's failed. He doesn't really have any options for chemotherapy because probably wouldn't work that well, and then we were worried about toxic exposure to the infant in the household. So we did another small surgery on Griffin to retrieve some cancer cells, and that was manufactured into a vaccine, the Canvax vaccine for him. And you can see within 4 weeks, all the cancer's gone. And we followed him up for 4 years, and the cancer never came back. So he was only given 8 to 12 weeks to live initially with that cancer there after it came back after surgery, and he got 4 years of cancer-free life before he succumbed to arthritis and old age. So he was able to live out the rest of his lifespan cancer-free. So a very big success story for us, especially since there aren't a lot of actual treatments for this particularly aggressive cancer. And here's another dog that's received the Canvax vaccine. And this dog, Gus, he had a mast cell tumor on his wrist. Again, he was quite nervous at the vets. The owners didn't want surgery because that might require amputation of his leg. So he had just the vaccine as a treatment. And we can see the cancer shown in a couple of ways here. The pink and purple line up the top is the routine hematoxylin and eosin stain that pathologists assess. And the bottom line is a special stain called toluidine blue that stains the cancer cells a bright purple. Now, Gus was interesting. He had quite a lot of tumor tissue, so we were able to make quite a lot of doses of vaccine for him. And you can see that his cancer is beautifully suppressed by just looking at the number of purple dots down the bottom. It's beautifully suppressed by 4 weeks and stays gone for 9 months or so. Now, we actually ran out of his cancer vaccine because this was done during a clinical trial at around 9 months, and then the cancer actually came back when he stopped receiving the vaccine. So this suggests that some animals may require multiple courses or more booster doses of the vaccine just to try and keep a lid on their cancer and suppress it adequately. So we're looking at options to store tissue to make vaccine batches beyond the 6 months that we produce with CanVax. And then there's always an option if you're interested in getting another surgical biopsy, so more frozen tissues available to make future vaccines. And because the cancer mutates, that fresh tissue on the resurgery is probably more applicable to making a second vaccine. Now, I don't have any specific data for the NeoVax. That's still working through its clinical trial. The dogs that have had the NeoVax for osteosarcoma do well. We've seen extensions in survival time. The types of the survival time that we see on the osteosarcoma is equivalent to chemotherapy. But what we have seen with those dogs receiving the NeoVax is they have a lot less metastatic disease. So bone cancer tends to spread to the lungs. And when we followed our dogs through, sometimes now for 2 to 3 years, the dogs that have had the NeoVax aren't having the spread to their lungs. They're unfortunately succumbing to other things that are a risk to dogs with 3 legs, because dogs with osteosarcoma are usually treated with amputation, like unfortunately breaking their leg or having some sort of accident. And that's what the cause of death is for those dogs, rather than spread to the lungs, which is really, really common. So we think the early clinical trial data is suggesting that it's really beneficial for suppressing spread to the lungs. So just to wrap up, just to remind you that Animal Immuno Solutions covers a variety of options for immunotherapy in dogs, and it really comes down to whether your patient or your pet has residual tumour still present in their body. If they do, then they'll be suitable for an intratumoral adjuvant injection. So they're one-off treatments with powerful immunostimulants. It's very easy to deliver, and the immunostimulation lasts for a very long time, which is, lasts for weeks or months, and that's why you don't need to retreat the animal. But it's only suitable if there is actually cancer still physically present in the body. For those animals that can have surgery and all or part of their cancer can be removed, they're much more suited to the different autologous vaccines. So we recommend CanVax for nearly all tumours and NeoVax for osteosarcoma. If you have any questions, please have a look on our website and reach out to us through our web form or via email to get some more information. We're very happy to send more information to veterinary surgeons particularly, and to help vets working with their patients and their clients to decide if immunotherapy is suitable for the animal, if it's going to be of benefit, and if it will fit in with their treatment plan. So you can have immunotherapy in your pet along with surgery, along with chemotherapy, along with radiation. It doesn't interfere with those treatments. It doesn't cause the animal problems. It doesn't make them sick. It doesn't produce any toxic residues that are dangerous to the veterinary care team or the animal's family, like chemotherapy can. So it's a really good option for going in and combining with normal standard of care therapy for animals that have cancer, or being used as a standalone therapy if you have any reservations against using standard of care therapy and you've talked to your oncologist or your vet and you've decided that it's not for you. And we have had, as you can see, some animals where the standard of care therapy like chemo just wasn't an option. It wasn't an option for the owners, so they've used immunotherapy instead. So just to end on a happy note, this is Griffin and his little owner. And if you remember the first slide I showed you, she was just a baby. But because the immunotherapy was able to buy him so much time, 4 years of time, she's grown up now, and she's had all that time with her pet, and he's had all that time with her. So we considered this a really wonderful success story, especially in a cancer like non-epithelial epitheliotropic T-cell lymphoma, where there's really not a lot of options for the animals. So thank you for watching our presentation and having a look at what Animal Immuno Solutions can do for your pet with cancer. My name's Professor Rachel Allavena. I have a PhD in comparative medicine and immunology from Cornell University. I am a board certified specialist veterinary anatomic pathologist with the American College of Veterinary Pathologists. I have my veterinary degree from the University of Queensland, and I've spent the last 15 years developing immunotherapy products for pet dogs that naturally suffer from cancer. I have a background in the pharmaceutical industry, which has taught me about drug safety research and development and how to design and produce and assess therapies that are gold standard for applications in veterinary medicine. And I'm really proud to work with Dr. Annika Oxer. Dr. Annika has a PhD in the development of immunotherapeutics for cancer in pet dogs from the University of Queensland. She's also a board certified veterinary anatomic pathologist with the American College of Veterinary Pathologists and a veterinary surgeon. And Annika has a very long, successful history in general practice and a very strong focus on general practice and looking after her patients. She's also undertaken postgraduate training in oncology and learned and developed a passion for cancer. So together, we're really happy to have had the opportunity to do research on these products and also to form the company, and hopefully we will be out there helping many, many more pets in the future.